Hey guys, welcome back to another video by Funda Dental. This is your host, Dr. Ishwar, and today we'll be heading back to the chalkboard to see and understand about what really is MDS and why is it so important to get into this course. So I'm sure this question arises into your mind soon after you've started your internship life. Your final year exams have ended, and now you're thinking, what next? Do I start with my clinical practice? Do I set up my own clinic? Do I work at someone else's clinic, which is more established? Do I require more experience? Do I understand that I'm good enough and I start working? Know one thing for sure, there is no option among these that are wrong. Everything that you believe you can achieve, you really can. If you think you can start off your clinical practice right after you exit your undergraduate degree, you sure as hell can. And if you think you need a little more time to experience the clinical world in a more controlled environment in a private clinic as a junior dentist, that's fine. And if you think you are ready to take up some of the bigger shoes and become a specialist in a subject you really enjoyed in your final year, well, that's what we're here to talk about. The MDS, or the Masters in Dental Surgery, is a very well known and renowned um, title for all those who are basically more into academics and who also seek the what is the exact word, the title which allows them to successfully practice an art that is a little more well equipped and designed to a specialist. Okay, so why is it so important? So first let us discuss what MDS really is. So basically, MDS, or your masters in dental surgery, is a postgraduate degree. Now, who is eligible to take up this course? Of course, it's a BDS graduate, like you and me, who've just finished. Now, a BDS is a UG degree, and an MDS is a PG degree, right? But one other thing that you need to know is that not the only route to become a little more skilled in your practice is through MDS. There's also another route known as a diplomat course. Now, the diplomat courses can be in any of the 9 beautiful subjects we study in the third and final year. Now, the diplomat courses last from anywhere between 6 months to about 2 years, depending about where and how you manage to or wish to do it. Okay, so this is a basic ideology. Now, as you already know, your BDS was for 5 years, including your internship. Your MDS will be of 3 years without an internship. Okay, so now that's clear. So the next question is, how do I get this? Well, basically, your MDS can be attained right now through a NEET PG exam. Now, what is NEET PG? It is very similar or reminiscent of your CET exams. So there will be 240 MCQs, okay, which you need to answer in about 180 minutes. The questions range from all of your first, second, third, and final year BDS subjects. Okay, so the questions can be anywhere from what happens in general surgery, to what happens in dental materials, to which important specimen did we read in micro, to what happens when a pipette accidentally crushes your hand in path. So now the challenge is to study for MDS and get it as soon as possible. Correct? Let me just silence my phone. Perfect. So now that we have an outlook of the exam, let's discuss about why it's important and what exactly do you get in this MDS degree? So an MDS degree, unlike a BDS degree, is more clinically oriented, right? So on a basis, you will be attending less theory classes in class and more patients in college. Okay, so what does that really mean? So all the theory that you were used to being fed in class in your undergrad, you'll have to do it on your own. So at home, you'll be busy grinding books, right? And it's not that one book for one subject philosophy in MDS. It's one subject demands 10 to 15 books, or sometimes even more. And now the other thing is the patience factor. An MDS personnel usually deals with patients most of his day, other than giving seminars, spot discussions, case presentations, among many more of his duties. So now, what are the subjects in which you can do your MDS? Well, there's of course surgery, orthodontics, periodontics, endodontics, and prosthodontics, and of course perio, which come into more of a clinical category. And then of course there are the subjects of oral medicine, oral pathology, and then of course there's public health dentistry to service the community. And of course I'm definitely letting out something here, which would be nothing else. I think I've gotten all of them. So these three come into more of a theory plus behind the scenes kind of criteria based subjects. So now, based on my observation or what my seniors have told me and what I wish to tell you, oral surgery, ortho, and endo are most in demand, as in these are the hardest to get, whereas pedo, perio, and prosto are the next best choices if you want to go to the clinical side. Oral medicine offers a wider exposure into radiotherapy, chemotherapy, and more research-based techniques in oncology. Oral pathology gives you the freedom to open your own diagnostic laboratory. And public health, of course, requires your most generous support for the welfare of the country. So guys, I hope this was informative. Thank you and have a nice day. And if you like these sessions, then be sure to like plus subscribe. I wish to see all of you in the future videos. Thank you and have a nice day. Goodbye.